Hi, a warm welcome to Smell Bell Verbal ENT India. Today we are going to have a basic understanding of allergic rhinitis, which is one of the most commonest, that is the sixth most prevalent disease in the world. With allergic rhinitis, it is IgE mediated. IgE are a group of antibodies that are produced in the body. IgE mediated immune response by the body towards the allergens, whatever they might be, and it is characterized by severe sneezing and itching all along the upper respiratory tract, that is about the nose, and the blocking sensation of the nose, and rhinorrhea, which is lot of secretions from the nose. It is of two types nearly, like seasonal and perennial. Seasonal in one season, perennial means all along the year, and mixed type is also seen sometimes. The causes are like mainly the inhalant allergens like dust mite, dermatophagoid stereonismus, one of the important cause, and also from the insects and also from the pets that we have the mites most commonly. That is the inhalant allergies. And second thing is about the genetic predisposition. If one parent has got the allergic rhinitis, there is 20% chance, and two parents, there is 47% chance for the child to get the allergies. What is the reason behind this in depth? There is a pathogenesis. Once these antibodies are formed inside the body by means of this antigen, which is the dust. Antigen is the dust which is foreign. Antibodies is the reaction produced by the body. So what happens is, these antibodies, they have got FABN and FCN. This is FCN, this is FABN. This FCN comes and attaches to these mast cells, tissue mast cells, TMC, or basophils of the blood. Basophils of the blood or tissue mast cells. It comes and attaches to this with this FC term. This is FC, FA, FB. Okay. Once it gets attached, what happens? There is a priming effect. There is a priming effect of this particular thing. Once there is priming, subsequent exposure, the antibody is getting an attachment with the antigen here. If the antigen is coming and sitting here, subsequent exposure, it causes chemical reaction in these particular cells, that is tissue mast cells or the basophils in the blood. So in that way, a lot of chemical mediators are released and leads to vasodilation, that is increasing the size of the blood vessels, and edema, that is pouring off of the liquid from the blood vessels, and a lot of eosinophils, as we say eosinophilia. Eosinophils are also seen. Initial effect is called as this priming effect. This priming effect, and later on it is the secondary effect that comes. Once the antibodies are primed, there is a lot of these effects. So release of the preformed or the newly synthesized chemicals leads to these things. What are the preformed things? Number one is histamine. Number two is eosinophilic chemotactic factor A. Number 3 is neutrophilic chemotactic factor A. Number 4 is heparin and others. What are the newly synthesized ones? That is PGD2, prostaglandin D2, and slow reacting substance of anaphylaxis like leukotrienes, and platelet activating factor PAF, and thromboxane A2, and TNF alpha. All these lead to acute phase within first 20 minutes, and then there is a chronic or the late delayed phase, which is in the 8 hours. Acute phase leads to sneezing and bronchospasm, difficulty in breathing, and chronic phase leads to neutrophil, basophil, and CD4 type of T cells recruitment. So whenever there is stimulation, what happens is the mast cell gives rise to tissue mast cells or basophils of the blood. There is a drop in CAMP by CGMP ratio. CAMP by CGMP ratio. CAMP by CGMP. CGMP increases. Leads to release of new formed mediators. Increased permeability tissue edema leading to edema, that is nasal blockage, and then change in the smooth muscle tone leading to bronchospasm, and glandular secretions leading to rhinorrhea.